Here we have our client, a 72-year-old woman, a widow of 6 years to a previous farmland renter. She since then had to move out of her previous home into a government-subsidized apartment complex for the elderly. There she enjoys all of the activities and tries to never miss any. She's unaware of her current weight and is currently a pre-diabetic. And today she's come to our mini health fair.
Hello, Martha Jones. I'm Dr. Funnybones.
Oh, it's so nice to meet you.
How are you doing today?
I'm doing pretty well.
Now that I've taken your vital signs, I'm going to read them back to you.
Excellent.
Your blood pressure today was 150/80. How do you feel about that?
Pretty good.
Well, it's a little higher than I would like it to be. Your heart rate is 78 and your respiration rate is 20.
Oh, okay.
That's not bad for your age.
Great.
But I have some concerns. You're 5'3", but you're 230 pounds.
Oh, goodness, I've gained another 10 pounds.
How do you feel about your level of health today?
Well, I feel that I'm just healthy as a horse. You know, my mother, she lived to the ripe old age of 97, and I plan on living to be 107.
Are you experiencing any pain today, Martha?
Well, I'm gonna say no to the pain, but yes to some abnormalities. Final answer.
Can you elaborate on the abnormality?
Well, I have noticed a lump in my breasts, right about here, if you want to have a feel. Oh, goodness, excuse me.
That's okay.
My vision is
No.
so good these days.
That's okay.
Well, Dr. Funnybones asked me to come here. Are you Dr. Bosom?
Yes, I am. That's what they call me.
It's so nice to meet you. I'm Martha Jones.
Very nice to meet you, ma'am.
So did Dr. Funnybones inform you of my condition?
She did it. Let me take a look. Okay, so I understand that you have a lump in your left breast.
Yes, I did.
Okay, well, we don't have to focus on that just yet. We can do some charting before.
Okay.
So, have you been getting mammograms? After the age of 40, you should be getting a mammogram every year or two. And since you found a lump, you should schedule one.
Well, it has been about probably 30 years since I've had a mammogram, so I suppose I should schedule one.
Well, when did you first notice this lump?
The lump? Oh, wow. It's probably been there for 6 or 7 months. I've been very afraid to bring it to anyone's attention.
Oh, I understand that this can be a very, very scary topic for many people, so we'll try to take this one step at a time. Has the lump changed in size over time?
Yes, it's gotten a little bit larger.
When did you go through menopause?
I went through menopause at about age 51.
Have you experienced any nipple discharge recently?
Not recently, no.
Have you ever experienced any nipple discharge?
In my earlier years, yes, I have.
Okay. Have you experienced any breast trauma?
No, I have not.
Have you ever had a breast biopsy?
No, I have not.
Do you or anyone in your family have a history of cancer?
Well, my grandmother actually died of breast cancer, yes.
You might be at a higher risk of breast cancer due to your weight. You're considered overweight. So you're also at a higher risk due to your age, and your love of desserts may cause your fat intake to be high, which is also a risk factor for cancer. So if you notice a lump, it needs to be reported as soon as possible to allow for the best treatment. And you need to find a doctor to schedule a breast exam with, and we'll set that up for you. And we'll also get somebody to come in and show you how to do a self-breast exam and the information that comes with that.
Oh, thank you, Dr. Bosom.
So I just had a couple more questions. Is the lump hard or soft?
It's hard.
Do you have any inflammation around the lump?
No inflammation.
Does the lump feel warmer than the rest of your breast?
I would say no.
Do you have a history of alcoholism?
Well, back in my day, I was quite the partier. But not in many years.
Okay. Have you noticed any change in the texture of your skin on your breast?
No, I haven't.
And is the lump painful?
Oh yes, the lump is very painful.
We can all card that!
Random dancing!
Do you have any questions?
Well, I am worried about the costs associated with the treatment I'll be needing.
Oh, I understand. Let me get somebody in here who can better answer your questions for you, okay?
Thank you.
Hi Martha, I'm Dr. Tombstone.
Oh my gosh, thank you. It's so good to meet you.
No problem. Dr. Bosom told me you had some questions you want to answer.
Yes, I do. Well, first, I'm very concerned about the costs that will be associated with the treatment I may be needing.
Well, you do have Medicare, and I checked with the insurance, and that will cover you getting the mammogram.
Oh, excellent. Well, that sounds great. Well, I'm just concerned about my goals for the future, so I need to ask you, am I going to die?
Martha, that is very understandable. At your age, you should have gotten your breast checked out sooner, but we're gonna do the mammogram and see what the results come out to be. Hopefully, they'll be good and then we can catch it soon, but if it comes back and it's not what we're hoping for, we'll take cautionary measures to treat it.
So, you think it will be treatable if I do have breast cancer?
We hope.
Well, that sounds like a pretty good outlook to me.
Well, Martha, thank you so much for coming in. I hope this was helpful. Let's go set up an appointment to get your mammogram done.
Oh, thank you so much. You really helped decrease my anxiety. Can I have a hand up? Oh, thank you so much, doctor. Well, I just have one more question. Is this a good time to ask about a bunion?
Wait, are you ready?
Yeah.
Come on, put your coat on. Let's go.